Hello, my name is Marvin So. I am a medical student in the class of 2022 at the University of Minnesota Medical School. Today, we are talking with Krista Kaput, Director of EdAllies and a former teacher herself. We're going to be talking about exclusionary school discipline as a racial, social, and health equity issue as part of the Twin Cities Medical Society's Community Conversation series. Welcome, Krista.
Hi.
Thanks so much for being here with us.
Thanks for having me.
Yeah, I'm really excited for today's conversation and all we're going to learn together. So I guess just to start us off, for our listeners who are unfamiliar with the work of EdAllies, can you provide some background on your organization's mission and what you all do?
So EdAllies was founded in October of 2016, and we are an education advocacy nonprofit that partners with schools, families, and communities to ensure that every young Minnesotan has access to a rigorous and engaging education. So we work to advance policies that put underserved students first, remove barriers facing successful schools and programs, and foster an inclusive conversation about what's possible for students. We work on a wide range of education policy issues, from college and career readiness, data transparency and desegregation, teacher licensure and teacher preparation, and obviously school discipline. So in my role as research director, I'm in charge of developing and managing research projects, analyzing and synthesizing, wow, it's a hard word, data and research, elevating best practices, creating written materials, and then supporting our policy work.
To turn to the topic of today's interview, exclusionary discipline. Can you help our audience understand the basics? What is it? Who is affected by it? And when does it take place?
Yeah, absolutely. So exclusionary discipline is any type of disciplinary action that removes a student or excludes them from their educational setting. Two of the most common types of exclusionary discipline are suspension and expulsion. So there are actually two types of suspension: in-school suspension and out-of-school suspension. In-school suspension is when a student is still in school doing their work, but they're not in their classroom or their educational setting. They're often removed from the rest of the student body. Out-of-school suspension is when a student is temporarily removed from the school and activities, so like when they're staying at home. In both instances, the student can return to the regular classroom setting after the end of the suspension. Expulsion is the most serious consequence that requires school board action. So expulsion is a permanent removal from from the educational setting, and a student is not allowed to go back for at least a year. In Minnesota, we have large disciplinary disparities across race. So even though students of color and Indigenous students account for 34% of the student population, they account for 66% of disciplinary action. In particular, Black students account for 11% of the student population, but account for 40% of all disciplinary action. This is also an issue for students with disabilities. Students with disabilities represent 11% of the student population, but they receive 43% of suspensions and expulsions. And we can't do this at the state level, at least to my knowledge we can't, but nationally, the Department of Education found that students of color with disabilities are suspended and expelled at much higher rates than white students or students without disability. Some important context in Minnesota: our disciplinary disparities here are so egregious that in 2017, the Minnesota Department of Human Rights notified 43 districts and charter schools that they were being investigated for violating the state's Human Rights Act due to their significant disparities for other student discipline data. So their investigation found that Black students in Minnesota are 8 times more likely to be suspended or expelled than their white peers, and Indigenous students are 10 times more likely to be suspended or expelled than their white peers. And for comparison, nationally, Black students are suspended 2 times the rate of their white peers. So Minnesota has more acute disparities than the rest of the country. And so when we think about when students are being disciplined, schools can put categories. And so I looked at the data and I found that students are most often disciplined for things like theft, tobacco, fighting, bullying, disruptive behavior, attendance, which is the most ironic because yes, a child can be suspended for not attending school enough. And then there's the category of other. And when we think about other, this category can be problematic because there's a lot of discretion. So a student could be suspended for eye rolling or chewing gum or not wearing an appropriate article of clothing, right? It's very, it can be very subjective. And so it kind of, in terms of like how, like when it occurs, it kind of is at the, it kind of is more nuanced at the school level.
And a follow-up question I was going to check in about, which is, how Minnesota compares to other states. And it does sound like we are, unfortunately, kind of a little bit on the wrong side of the.
Absolutely.
Yeah.
Yeah. Thinking about, recording this in April after the Derek Chauvin trial for murdering George Floyd and Daunte Wright being murdered. Minnesota is a great place to live if you look like me, right? White, middle class. But for our Minnesotans of color, particularly our Black Minnesotans, this is not a great place to live. And we need to start having more conversations about that, and particularly thinking about our school system with our youngest learners of color, and how are we perpetuating these systems of racism, and also kind of hiding behind our aggregate data about how great we are as a state, right? Like really, I think really like dismantling this, we have this progressive idea, but I have to say Minnesota is actually really faux-aggressive. We think we're progressive, but we're really not. And in fact, we are perpetuating systems of racism in our state.
Yeah, that's so fascinating and troubling. And, layering it onto, this context, which is kind of for a medical audience in terms of physicians and other providers. We know when we study pediatrics and child development that these early years, these formative years really matter for health, for all sorts of outcomes. And, kids are sensitive, and these experiences that you're describing, so disproportionately kind of allocated, you can kind of start to see that those disparities can emerge quite early.
Yep.
Yeah. So I think one common conception that I've heard, at least, is that students who do misbehave in the classroom need to be taught a lesson, need to be appropriately managed so that we can preserve an optimal learning environment for teachers and for other students. What would you say to that argument? And can you discuss anything that we know about the possible harms and benefits of exclusionary discipline?
So I have actually yet to see evidence that exclusionary discipline practices are effective and actually deter future behavior. Rather, there's a large body of evidence that illustrates the link between exclusionary discipline practices and the increased likelihood of not graduating from high school, increased involvement in the criminal justice system, as well as lower academic performance and mental health. In fact, in 2019, there was this groundbreaking study from Stanford which found that specifically for Black students, there was a correlation between discipline disparities and achievement gaps, even after controlling for other variables. So when one gap narrows, so when the discipline gap narrows, then so does the achievement gap. And so when we're thinking about health outcomes and we know that a better educational attainment leads to better health outcomes, there's that, to me, it's just obvious that you want to really promote non-exclusionary discipline and inclusive classrooms and creating positive environments and addressing addressing our systemic racism, which is, throughout all of our institutions, so that all children can reach their potential and lead a life of their choosing.
Yeah, and relatedly, you were talking a little earlier about just the context with the Derek Chauvin trial and the Daunte Wright shooting, and it's interesting thinking about the relation to like the criminal legal system. Some people have talked about exclusionary discipline sort of representing the initial stages of the school to prison pipeline. For listeners that are unfamiliar with that concept, can you sort of describe what that pipeline is and maybe trace the trajectory a little bit for what that could look like for a child?
Yep. So the school to prison pipeline is the process by which students are pushed out of school and into the criminal justice system. And there are a few ways that this can happen. So in schools that have school resource officers, which are police in schools, educators can refer a student to a resource officer, which could result in arrest. And a recent study found that even the presence of school resource officers increases the use of out-of-school suspensions, transfers, expulsions, and police referrals. So just by having a police officer in the school, that doesn't make the school safer. It in fact exacerbates the school to prison pipeline. And when I was teaching, we did have officers I taught in 2 different schools in Chicago, and in this school where there were officers, I saw officers. I'm sure that there are some officers who maybe don't do this, but I saw the police officers in my school egging on my students, trying to get them to break parole. It did not increase safety of anybody. It in fact made us feel less safe. And then in the other school I taught in, there wasn't a school, there were not school resource officers, and it was a much better environment. So, but even in schools that don't have school resource officers, a school could refer a child to law enforcement or to a juvenile court as a form of discipline. And all of this makes it so that a student can get a record. And furthermore, we also know from research that when students are suspended, so just even taking out the referral to law enforcement or the school resource officer, when a student is suspended, even just once, they are more likely to be involved later on in the criminal justice system than a student who wasn't suspended. And these exclusionary discipline practices, I mean, they start early in a child's life. So nationally, in public pre-kindergarten programs, so I'm talking about 3 and 4-year-olds, the rate of expulsion is more than 3 times that than the K-12 system. So we're talking about 3 and 4-year-olds being suspended or expelled from their pre-kindergarten programs at higher rates than the K-12 system. And new federal data found that this is particularly happening for Black children. And so even though Black boys make up 18% of the male preschool population, they make up 41% of preschool suspensions. For Black girls, even though they make up 19% of the female preschool enrollment, they account for 53% of the female suspensions. Again, these are 3 and 4-year-olds. And these type of disciplinary measures can affect how students perceive themselves, right? They think that they're bad kids, can turn them off to school, which then over time can be compounded to lead to, falling behind academically, not engaged in school. And I mean, and then as we know, that impacts life outcomes. When we're thinking about Minnesota and we're thinking about practices, it's keeping kids in school and engaging in those restorative practices and teaching them and informing their brain and their development is critical, and not just pushing them out for being kids.
Yeah, absolutely. When you talked about those 3 and 4-year-olds, I think that really got to me. I mean, pushing the boundaries on behavior and self-regulation is kind of the hallmark of what kids of that age should be doing. And certainly there may be challenges and issues that those kids may be facing, but to punish them rather than to provide support. I mean, even if some of those kids possibly have some type of disruptive behavior disorder or ADHD that likely wouldn't even be diagnosed until a little later in life, around age 6 or so. And so you think about how just our response in terms of kids that actually may need support and therapy and maybe some type of health or social support intervention, but instead are getting, told these insidious messages or not so insidious messages early on in life.
Yep, absolutely.
Gosh, so I really appreciate how you kind of painted this picture for us, bringing in so much federal and local data and your own experiences as a teacher, and it's very disheartening. And I wanted to talk a little bit about thinking forward. How can we be more imaginative about solutions or alternatives? What can we say about that? Are there things out there that are available in terms of actions that can be taken at the level of individual teachers, schools, or policies?
Yep. So I want to highlight the work of a local coalition, the Solutions on Suspension Coalition. It's a coalition of students, families, community members, organizations, and nonprofits, including EdAllies, that is committed to ending racial disparities in school discipline so that all students can attend a school with a positive learning environment. So through the work of that coalition, last year, the Minnesota legislature passed a bill that banned dismissals for pre-K students. Not necessarily expulsions, but there's a process in place where students have to be engaged in non-exclusionary discipline practices first before they would get to that level of an expulsion. But it got rid of dismissals, which was a great first step for Minnesota. The coalition has also worked on expanding parental notification rights for when a student is suspended, creating guidance on creating guidance for schools on restorative justice practices, which I didn't really explain what that is. So say a student throws something across the room, right? Rather than send that child out of the class, there would be a process that the school would have done with educators and hopefully with families and students as well, but a process in place to talk to that student, to explain to them what they did was not appropriate, why it wasn't appropriate, and then to re-engage them back into the classroom. But it's really going through like what you honestly do as a teacher when a student doesn't understand a concept, right? You re-explain the concept, or if they made a mistake, you probe about where they made that mistake, and then you explain the correct way to do it, or like why that harm was caused, and then you re-engage them in that process. And so it's not excluding students. And so that's one of the things the coalition has advocated for, is guidance for restorative discipline practices, as well as some state funds for professional development, requiring that schools use non-exclusionary discipline practices before they remove a child from school, and then also clarifying grounds for dismissal. And also adding in definitions. It's important in statute that we have definitions for things. Right now in statute, we only have a definition for suspension. We don't have definitions for in-school suspension, out-of-school suspension, and that can be problematic when we're thinking about including children in the environment. And so that coalition has done amazing work, and it's filled with amazing people who are really passionate about this topic. But in addition to that policy work, oh, and I didn't even mention, right now, that they're also working on expanding that dismissal, that pre-K dismissal, to expand that from pre-K all the way up to third grade. And there's actually language right now. I know it's gonna be posted later, so I can't tell you if it's gonna pass or not, but maybe when we post it, I can have more information. But there's actually language in both the Senate and the House omnibus bills that would expand that ban on dismissals through third grade, which would be really great. In addition to those things, you need to take a really high level view about, yes, you can help train teachers and put in these policies, but we should also be looking on the entire spectrum of teaching. And so EdAllies has been working on ensuring that the standards of effective practice, which are the professional teaching standards that all teacher candidates learn in prep, include standards around classroom management, restorative practices, and addressing implicit biases. A recent survey found that only 20% of Minnesota teachers believe that their teacher preparation programs were effective in training them in classroom management. So like how to create a positive environment, setting up routines and procedures, which on the front end of teachers can do that can cut down on some of that disruptive discipline. And I'm doing this because sometimes when a teacher thinks a student's being disruptive, I think that's more of a I think it's more of a signal that the teacher didn't set up a proper process or procedure to engage that student. Many teachers are also eager for professional development and support in non-punitive disciplinary practices. And research has found that when restorative practices are adopted and implemented, this leads to school environments that are safer and with lower suspension rates. And then I think too, with implicit bias, and this is where I get to that kind of faux aggressive, we need to address our systemic racism. Minnesota teacher workforce is 95% white. This number hasn't changed in 20 years. 95% of Minnesota teachers are white. And over 80% of teachers currently enrolled in teacher preparation programs are white. And so while we work to racially diversify the workforce, which is critical, we can't put all of that on teachers of color and Indigenous teachers. White people and teachers also need to improve their practice. And so even though all teachers bring implicit bias to the room, this can negatively impact students, and it can be mitigated if teachers work to identify, unpack, and address them. And so, there's a ton of studies that show that white teachers tend to have lower expectations for students of color, think that, particularly for Black students, think that they can't, go to college or won't do as well, just some very negative stereotypes that white teachers should have to address and change practice. And this isn't just in discipline. This is referrals for advanced coursework. This is, thinking about when teachers make materials and the possible sources of bias that are in the materials, right? And so thinking about teacher prep, and then there's a couple of other programs that to create more of a positive learning environment, which can lead to a mitigation in discipline. So at the local level, and so there's, so when we think about like mental health particularly, so, and thinking about like COVID and like, you know, the police violence that we're seeing and like the impact that has on students, particularly our students of color and Indigenous students, particularly our Black students, thinking about providing mental health services, investing in counselors, wraparound services, and making sure that all of those are culturally responsive. So it's not just culturally responsive so that the students will actually be taken care of in a way that meets their needs. And so when we had some federal money that came in from the 3 different stimulus packages, and Governor Walz has allocated some money towards mental health. And so we're hoping that they'll do that still. There's also been a push at the state level to implement ethnic studies. So when students are, you know, seeing themselves in their curriculum and in their schooling, it's more more engaging for them, and it fosters positive identity development, which can also have a positive impact on student engagement and achievement. And so there's disciplinary things that are happening. There's things on the mental health side that are happening, which I think are just as important for addressing these issues. And then in terms of like what localities can do, there is a lot of power at the local level. And so I work in state policy primarily, and so it's very nuanced, but you know, addressing your school board, if you're in a district school, and then charter schools have their own individual school boards, but still talking to them. Teachers can be advocating for, you know, specific types of professional development. There's a lot of things that localities can do, but I think it's really important that people start working with community and not upon community, you know, to address these changes. Sorry, that's a lot.
That was amazing. I feel like you gave us like at least 3 different things we can kind of do at every level to kind of move this conversation forward. That's really, really helpful. And the work of that coalition that you're mentioning, I think is amazing. And we can definitely share the link to their website and the current advocacy they're doing when this is posted in July and whatever phase that's in.
Right.
Yeah. So my last question is, you know, this interview is going to be shared with physicians and health professionals and students across the Twin Cities. And I'd love to close our conversation with our key message for them. Why should healthcare providers care about exclusionary school discipline, and what role can they play?
So we know that educational attainment is linked to better health outcomes, better jobs, higher earnings, more stable housing, increased access to better healthcare services, all of which are critical to long-term health. But at the same time, we also know that exclusionary discipline practices leads to lower academic achievement and lower mental health, and increased likelihood of not graduating and being funneled into the criminal justice system. And so there's a clear relationship there. But despite this clear relationship, too often policy areas, education, health, housing, operate in silos, which I think is to the detriment of everybody. And so I think we need to find ways to do more things like this, where we're talking with one another, seeing where we can advocate together, collaborate on policies and research. You know, I remember I think it was a couple years ago, the American Academy of Pediatrics, they issued this policy statement, which offered evidence about the continued negative impact that racism has on health and the well-being of students. And their statement was great. And, you know, it talked about ways that doctors can engage in their patients' health and well-being, and links between, you know, different implicit and explicit biases. And I remember reading that statement and being like, everything that they're saying relates to education. And so thinking about ways that we can like collaborate together to you know, elevate these best practices, I think is really important for making systemic change. And so, you know, if there's a legislative hearing on school discipline, you know, it'd be great for medical students or physicians to also show their support, whether that be through testimony, a statement, attending community meetings, talking with students and families, and vice versa, right? If there's something in health and human services that relates to students, I think it'd be important for people in the education space to be like, yeah, we support this. And obviously, we know that systemic racism is pervasive throughout all of our institutions and systems, and it has a negative outcome for students. And so if we're going to make systems change based and eradicate racism and ensure that every child reaches their full potential, we need to work together, and we need to work with and not upon community and those impacted to make that change. So I wasn't as specific as I could be, but I think this is a starting point. And in terms of like specific touch points and things you can do, I think it's just going to take us working together to be intentional and thoughtful about what that looks like and how things are implemented.
Yeah, no, that was super helpful. I love that call for more cross-sector collaboration and conversations, and as well as your point about, centering those most affected by these punitive policies and practices, and as we think through what more restorative and supportive approaches could look like.
Yeah.
Yeah, and I actually did see that policy statement on racism a couple of years ago. That was really awesome. They also have one on school discipline, which I can share as well in the links. It's from, I believe, 2013. So it's, getting a little old, but I think, just reflecting on what I recall hearing when I read it a while back, some of the things they recommended, at least on the clinical side of things for physicians, is even the basic thing of just asking about issues or progress with behavior, academic progress, any issues with discipline, because as you're saying, if a kid is encountering these instances of suspension and expulsion, that could be a marker of later risks, unfortunately. And in some ways, as providers, we're sort of seeing the downstream consequences of these educational and systemic policies and historical policies that you were describing. And so I think there's a lot that providers can do, from as small as just asking about it with the kids that they see, as well as larger things like attending meetings and supporting advocacy and projects that you were describing. So
yeah, that sounds great to me, Marvin. Let's stay in touch and let's get this done.
Let's make it happen. Well, awesome. This will conclude our interview with Krista Kaput from EdAllies. We so appreciate her time today. I'll share the link to some of the resources and studies that were mentioned in today's conversation when this video is released. And we thank you for your time and your engagement in this conversation. We hope you'll all consider joining the conversation and how we can better lift our children up rather than push them out.